Hi, this is Dr. Jaime and welcome to my podcast. Today I want to share with you some information about atopic dermatitis. Atopic dermatitis, often referred to as eczema, is a chronic, long-standing disease that causes inflammation, redness, and irritation of the skin. It is a common condition that usually begins in childhood. However, anyone can get the disease. Atopic dermatitis is not contagious, so it cannot be spread from person to person. Atopic dermatitis causes the skin to become extremely itchy. Scratching leads to further redness, swelling, cracking, weeping clear fluids, crusting, and scaling. In most cases, there are periods of time when the disease is worse, called flares, followed by periods when the skin improves or clears up entirely, called remissions. Researchers do not know what causes atopic dermatitis, but they do know that genes, the immune system, and the environment play a role in the disease. Depending on the severity and location of the symptoms, living with atopic dermatitis can be hard. Treatment can help control symptoms. For many people, atopic dermatitis improves with adulthood, but for some, it can be a lifelong illness. Atopic dermatitis is a common disease and usually appears during infancy and childhood. For many children, atopic dermatitis goes away before the teenage years. However, some children who develop atopic dermatitis may continue to have symptoms as teens and adults. Occasionally, for some people, the disease first appeared during adulthood. The chance of developing atopic dermatitis is higher if there is a family history of atopic dermatitis, high fever, or asthma. In addition, research shows that atopic dermatitis is more common in non-Hispanic Black children and that women and girls tend to develop the disease slightly more often than men and boys. The most common symptom of atopic dermatitis is itching, which can be severe. There are some other symptoms. We may say red, dry patches of skin, rashes that may ooze with clear fluid, or bleed when scratched. Thickening and hardening of the skin also can be included. The symptoms can flare in multiple areas of the body at the same time and can appear in the same location or a new location. The appearance and location of the rash vary depending on age. However, the rash can appear anywhere on the body. During the infancy and up to 2 years of age, it is most common for a red rash, which may ooze when scratched, to appear on the face, scalp, areas of the skin around joints that touch when the joint bends. Some patients and some parents worry that the infant has atopic dermatitis in the diaper area. However, the condition rarely appears in this area. During childhood, usually 2 years of age to puberty, it is most common for a red thickened rash which may ooze or bleed when scratched to appear on the elbows and knees, usually in the bend, neck, ankles. During the teenage and adult years, it is most common for a red to dark brown scaly rash, which may bleed and crust when scratched, to appear on the hands, neck, elbows, and knees, usually in the bend, skin around the eyes, ankles, and the feet. Other common skin features of atopic dermatitis include an extra fold of skin under the eye, which is known as a Denny Morgan fold, darkening of the skin beneath the eyes, extra skin creases on the palms of the hands and soles of the feet, In addition, people with atopic dermatitis often have other conditions, such as asthma and allergies, including food allergies, other skin disease such as an ichthyosis, which causes dry, thickened skin, depression or anxiety, sleep loss. The researchers continue to study why having atopic dermatitis as a child can lead to the development of asthma and hay fever later in their lives. Complications of atopic dermatitis can happen, and we might count bacterial skin infections that can worsen from scratching. These are common and may make the disease harder to control. Viral skin infection, sleep loss that can lead to behavior issues in children, hand eczema, also known as hand dermatitis, eye problems such as conjunctivitis, named pink eye, which causes swelling and redness in the inside of your eyelid and the white part of your eye, blepharitis, which causes general inflammation and redness of your eyelid. No one knows what causes atopic dermatitis. However, researchers know that changes in the protective layer of the skin can cause it to lose moisture. This can cause the skin to become dry, leading to damage and inflammation in the skin. New research suggests that inflammation directly triggers sensations of itch, which in turn cause the patient to scratch. This leads to further damage of the skin as well as increased risk for infection with bacteria. Researchers do know that the following may contribute to the changes in the skin barrier, which critically regulates moisture: changes in genes, problems with the immune system, exposure to certain things in the environment. Now, I want to talk a little more about genetics. The chance of developing atopic dermatitis is higher if there is a family history of the disease, which suggests that genetics may play a role in the cause. Recently, researchers found changes to genes that control a specific protein and help our bodies maintain a healthy layer of skin. Without the normal levels of this protein, the skin barrier changes, allowing moisture to escape, exposing the skin immune system to the environment, leading to atopic dermatitis. Researchers continue to study genes to better understand how different mutations cause atopic dermatitis. Now that we are talking about the immune system, we need to know that the immune system normally helps to fight off illness, bacteria, and viruses in your body. Sometimes the immune system becomes confused and overactive, which can create inflammation in the skin, leading to atopic dermatitis. Also, we are talking about the environment, so we must talk a little bit about it. Environmental factors may trigger the immune system to change the protective barrier of the skin, allowing more moisture to escape, which can lead to the atopic dermatitis. Some of these factors may include exposure to tobacco smoke, certain types of air pollutants, fragrances, and other compounds found in skin products and soap, excessively dry skin. Well, I hope you enjoyed this episode. We will see you in the next one. Thank you.